Risa Payent was made executive director of Planned Parenthood Regina in March, and just a month later, the organization received an eviction notice. Payent had to lay off employees due to a lack of location and start hunting for a new home base for Planned Parenthood. But it hasn't been easy.
We've unfortunately had some landlords who weren't willing to work with us because of use, so rejected on the basis of use, which I think speaks to some of the stigma around the work that we do in sexual health here in our province. And additionally, costs are rising, our funding is pretty stagnant, so we're trying to make sure that we're finding a space that's a good fit, but one that we can actually sustain in the long term.
Payet says many people have misconceptions around their services. For example, Planned Parenthood does not offer surgical abortions. Right now, the organization can only offer services over the phone. That includes consultation on sexually transmitted infections and contraceptives. But the lack of a physical location has left some gaps.
I think the biggest thing is really the sales of the birth control, especially for young people. We were selling birth control at cost, which is significantly reduced from what you would get at most pharmacies. So if you're someone, especially a youth, who doesn't have access to benefits and coverage, drug prescription coverage, then they were really counting on that.
Planned Parenthood's office closure has directly affected students at the University of Regina. It used to offer free sexual health clinics to students once a month with a nurse practitioner on hand.
Students did not need to have a Sask healthcare card number in order to access the services. And so we found that a lot of international students who hadn't yet gotten their healthcare card were able to access the services.
But right now, these clinics are not available for students in need. Meanwhile, Payet says the reason why Planned Parenthood has not been able to find a new home is because many locations are out of their price range. She says more funding from the provincial government would be helpful. In a statement to the CBC, the Ministry of Health said, "We thank Planned Parenthood for their ongoing work to support Saskatchewan residents. Health funding must be balanced within the context of the many competing priorities for healthcare dollars. Any funding requests would be considered as part of the annual budget process."
We are okay. We're going to be okay. I have every faith that we will be back and serving folks as soon as we possibly can. What we really need is support and patience, and for folks to just believe in us a little bit.
Planned Parenthood says financial donations from the community would help. Laura Sharpaletti, CBC News, Regina.